restrictions were removed, and a fiscal package was created that covered all the remaining costs for the testing and treatment. But also during many points in the first 2 months of this year, specific policies were devised in order to be able to cover the needs of specific vulnerable groups. So calibration in risk assessment, calibration in the health system capacity, and with this diagram teaming with control measures, some marking their imposition, some marking their relaxation or lifting, is a diagram schematic, because there's much more to show, of the control measures that were implemented across the period of the epidemic. So the control measures are themselves calibrated by the risk assessment, by the assessment of whether there are cases, whether no cases at all, whether there's sporadic transmission, whether there are clusters, or whether there's evidence of community transmission. And then that led to the third set of decisions, which is what level of measure to implement. Universal precautions from the universal wearing of masks, hand hygiene, from respiratory etiquette and social distancing, the isolation and treatment of cases, and the identification and quarantining of close contacts using the 4 earlies: early recognition, early reporting, early isolation, early treatment, in order to achieve the best epidemiological and public health and clinical outcomes, the control and limitation of mass gatherings, and in its most extreme, in Wuhan, the shutdown of a whole city or a number of cities in Hubei. All of these fit within a system of multi-sectoral coordination, the Joint Prevention and Control Task Force, and a major investment of fiscal support to both the health and to the economy. Bottom up, it needed a system of information that is the big data approach and mass testing, not just testing of the whole population, but testing of target groups, those with symptoms, those and the contacts of the cases that were identified. Finally, and a very important component, both through communication and through cultural factors, all of these met or were so successful because of a high dose of social consent. So in a very brief 10 minutes, what I have hoped to do is to break up what might seem as a very large monolithic approach that is often referred to in media discussion, and showed how a set of tools were created that can calibrate and produce policies that not only apply to the whole of the country, but at the lowest level of community, indeed could be targeted down to the individual. The information structure that underpins this is something that other countries could really learn from, as well as from the graduation, the fine resolution of this approach. With again, my thanks for your invitation and for your attention. Over to you.
Thank you, Dr. Gali. As the public health organization of the greatest authority in the world, WHO plays a crucial role in guiding the control and prevention of COVID-19 around the world. And now I would like to give the floor to the co-organizer of this event, Mr. Lu Qingjun from NHC Center for Telemedicine Management and Training. Mr. Lu, you have the floor. Thank you. Dr. Chen Zhu, Dr. Gallier, Dr. Zhong Nashan, Li Lanjuan, experts from home and abroad, ladies and gentlemen, participants in the webinar, good evening. As part of, as the co-organizer of Inside COVID-19 Global Public Health Management Training, I would like to extend our warmest welcome on behalf of the organizer and our heartfelt gratitude to Mr. Zhong Nanshan, Wang Chun, Li Lanjuan, and all the health care professionals who have been fighting on the front line against the COVID-19. Since January, the COVID-19 broke out and tightened its grip around the whole world. And thanks to the support of CPC with Central Committee, with President Xi at its core, and the healthcare professionals around the whole world, as well as the social consent and the public engagement, our efforts to control and prevent all the pandemic pays off. The control and prevention efforts have been spoken highly of by WHO and all international organizations. I think Dr. Gallier is speaking also at the same time. COVID-19 is a brand new disease. Before we were able to understand this disease has already threatened tens of thousands of lives. Dr. Gallier, please mute the channel. China is the first country to tackle the COVID-19 head-on and has gained an accumulated experience in fighting against this pandemic. And a very good evidence of our efficiency in our work is the low mortality and case fatality rate. However, COVID-19 knows no boundaries. And in the age of globalization and worldwide interactions, we are seeing a global village that is increasingly interconnected. And at the same time, technological progress has allowed us to play a better role in control and prevention efforts. And at the same time, they also allow us to keep communicating with different people despite the social distancing and the stay-at-home orders in different countries. And this webinar is a very good evidence and proof to see how we can use and how we can leverage the internet technology to communicate and to share our experience in control and prevention efforts, despite the boundaries between the countries, despite the distance and the time difference. And international technology allows us to better understand each other. And this event is also a follow-up resonance to the WHO call and the initiative by various parties. And we are very glad to have with us Mr. Zhong Nanshan and Ms. Li Lanjuan and other experts from all around the world, so that we can exchange our view and our information and experience in control and preventing COVID-19 with the whole world. We hope that this experience of control and prevention of COVID-19 can be beneficial to you. And we hope that this is also a testament to our responsibility as a big country around the whole world. And this can also be a way to break down the barriers of information between big countries and small countries. And it is at this moment when we see that countries like China can assume the responsibility as a major member and player and stakeholder in the international community. And we have also set up a makeshift hospitals and other centers for telemedicine, as well as centers for information and exchange experience sharing under the framework of National Health Commission. And these centers allow us to mobilize and put together all the best experts across the whole country to facilitate the prevention and control of COVID-19, not only in different cities, but in Wuhan and Hubei province particularly. And at the same time, these online consultation platforms can also allow us to deliver pharmacy services as well as prescription services for people with chronic diseases. And these efforts are also highly valued and appreciated by the international community as well. And now, as the COVID-19 is also spreading across the whole world, we are also seeing our efforts extended to other parts of the world. And the popularization of control and prevention knowledge is also part of our responsibility. And this Inside COVID-19 Global Public Health Management Training Program is also supported by China Primary Healthcare Foundation as well as CNPA and the CAPP. And at the same time, we are very glad to have with us a lot of experts who are willing to share with us the first-hand experience in control and prevention of COVID-19. I think this can be a very good webinar for all the healthcare professionals around the whole world in fighting and controlling the COVID-19. And this can serve as a unique platform for us to exchange our viewpoints and best practices. And I hope that this can be instrumental in fighting against the COVID-19 in the future in other countries. And we can, and I hope that through this platform, we can theorize all the best practices in fighting against the COVID-19, so that we can step up our public health construction system, as well as our public management of infectious diseases, not only in China, but also across the whole world. And once again, I would like to extend my heartfelt thanks to Mr. Chen Zhu, Mr. Dr. Galiye, Zhong Nanshan, and Li Lanjuan, as well as all the healthcare professionals who fight on the front line, and all the participants in this webinar. And I hope that together we can triumph over COVID-19 as soon as possible. Thank you.
Well, thank you, Director Wu. Ever since the outbreak, we've seen teams under the leadership of Academician Zhong Nanshan, Academician Li Lanjuan, and so many other professionals like Academician Wang Chen, Zhu Guang. They have led by example. They really went deep into Wuhan to get a full assessment of the situation on the ground, and they have kept studying, collecting material and experience, best practice in diagnosis and treatment throughout the course. So we're very honored to have with us Academician Zhong Nanshan this evening to participate in this international webinar. Now I would like to hand over to Academician Zhong. You have the floor, sir, on treatment and diagnosis of COVID-19.
好，谢谢可凡先生。
Thank you.
So,
That's all.
我下头 yes. So, in the next 10 minutes, I would like to just make some points about what China had done in combating the COVID-19. Can you hear me? 能听得见吗？ Can you see the slides?
Yeah, we can see the slide and we can hear you.
All right, thank you
Greetings
very much.
from Germany. Yeah.
Sure, thank you. So I suppose just now had Dr. Gali had mentioned about that's up to last day, yesterday. So that's the number. So more than 800,000 people been diagnosed, and more than 40,000 people died because of COVID-19 infection. So more than 200 countries and area infected. I'm not going to talk this too much. I just make some points. First is about China's strategy in controlling further spreading. So I think that's the time. So the steering committee of the experts in Wuhan, so including Professor Li and Professor Yun, Professor Gao, and me. So we just announced there's a definite human-to-human transmission and also confirmed. So medical staff have been infected since then. So we had to make so the government have been facing two choice. So first is in dealing with this very high contagious disease, we are moving to the strategy of suppression or mitigation. milligrams twice daily for 10 days. So this is just the result, because they had not published. So I just show you the result. Patients in chloroquine group have a much more shortened time to reach undetectable virus RNA compared with the control group, 3 days versus 9 days. And the second is by the day of 10 or 14, high proportion of the patient have the virus RNA turned into negative. So 91.4 and 95.9% as compared with 57 or 90, also significant. And however, the duration of of course, and also the duration of fever, so significantly shorter in chloroquine as compared with control group. So, sorry. And also, I suppose another point. So I didn't mention about that. So there's no significant difference in shortening the virus turn into negative. So no significant difference. But anyway, this kind of the study showing some effective, in particular in mild or moderate kind of COVID-19 infection. This is another story just published. It's also using hydroxychloroquine and azithromycin as a treatment of COVID-19 infection. That very few patients, only 20 patients, 600 milligrams hydroxychloroquine per day, and then
treatment of COVID-19. And artificial liver blood purification system was also an issue of interest. And as a matter of fact, this system was studied initially in 1986. And at that time, artificial liver blood purification treatment can significantly reduce cytokine levels in acute liver failure patients. And this ALS system has been popularized in hundreds of hospitals in 31 provinces and cities nationwide. The artificial liver blood purification system, and this system allows us to integrate plasma exchange, absorb perfusion, and carry out filtration, which can significantly clear inflammatory mediators and block the cytokine storms. For cytokine storms, artificial liver system, can the artificial liver system be also effective for COVID-19 patients? For age 7 and 9 patients, it worked perfectly. And this time, we used the ALS system on COVID-19 patients too, and we could see that we could significantly purify the blood of the COVID-19 patients. We could improve the respiration. We could reduce the administration of vasopressor drugs for shock patients, and we can also significantly reduce the conscious drowsiness of conscious fatigue of the patients. And in the treatment and the administration of ALS in Wuhan People's Hospital affiliated to Wuhan University, we could also see some efficacy. And here there are some cases of patients. A 56-year-old, and you could see that there had been persistent high fever after 9 days after the onset, rapid shortness of breath with a respiratory rate of 30 per minute, And then blood oxygen saturation fewer than 93%, and CT showed lesions in the lungs of over 50%, and the elevation of IL-6. And after 3 times of ALS treatment, we could see that the IL-6 and CRP were significantly decreased. And at the same time, after 14 days of hospitalization, viral nucleic acid test was negative, and he was discharged after 24 days of treatment. And then there was another 59-year-old male case, and the respiratory rate increased to 42 per minute significantly, and the heart rate dropped suddenly to 35 per minute. And under these circumstances, the oxygen saturation decreased to 40%, which was a sign of a severe hypoxemia. Under the condition of 100% oxygen inhalation by non-invasive ventilator, we also used the ALS. And thanks to several times of ALS, the oxygen saturation improved, and the oxygenation also improved. And after the second artificial liver treatment, oxygen saturation increased to 96%, and depressurization stopped, and the tracheal intubation was removed after 5 days. And now he has already been discharged, and actually he was discharged after 43 days of hospitalization, and he was really grateful to us for saving his life. And another 56-year-old female patient, and he actually missed the best period of ALS treatment because ALS was administered only after 15 days of condition development. So you can see that on day 23, there was a septic shock, coma, dilated pupils, and no response to light. And thanks to our ALS as well as other treatment to maintain the water electrolyte and acid-base balance, her condition improved significantly. The water electrolyte and acid-base balance was restored, and she is now still in hospital. However, her vitals are becoming more and more stable. So she is also very grateful to us. And then at the early stage, again, to wrap up, at the early stage of COVID-19 and cytokine storm, ALS can be very helpful. When the daily rising rate of inflammatory factors such as IL-6 is greater than 1 time or above, or the inflammatory factors is greater than or equal to 5 times the upper limit of the normal, we can use the ALS. And because the efficacy of ALS, this was not only included in the 7th edition of protocol for diagnosis and treatment, this was also included in the consensus of experts for treatment of COVID-19. And the artificial liver blood purification system can remove inflammatory mediators, block cytokine storms, prevent the progression of severe patients to critically ill cases, and significantly improve the success rate of treatment of severe and critically ill patients with COVID-19. And this is a picture of our team who had been worked in Wuhan for 2 months. When the country is suffering from ordeals, it is our responsibility to tackle this challenge head on. That's all for me. Thank you very much.
Thank you very much. Both academicians, Zhong and Li, both of you respectively have introduced to us what's going on out there in the front line. And thanks to your introduction, for example, academician Zhong told us that in your clinical practice you use chloroquine and tozumilumab and lianhua qingwen capsule and mixed hydrogen and oxygen and as well as ALS could significantly help patients from progressing into deteriorating state, especially academician Li. She specifically pointed out to the important role ALS plays in helping the severe and critically ill patients help slow down or curb the effect of cytokine storm, save more lives. Put it short sentence. And then, as we have also realized from both of your presentations, that we're excited to see that TCM, in the process of curbing and containing COVID-19, TCM are playing a very important role, like a 血必净 injection and 氧化氢跟 LHQW capsules. They are playing increasingly important roles. So I'd like to thank both of you academicians for your great and immense contribution to China's fight against COVID-19. I believe you are held at a very high respect by all of patients and Chinese nation. And so much of your introduction of your experience to us so far, we've seen over 3.3 million online viewers on this webinar. We'd like to welcome more and more participants into our discussion. Now we will enter into the second part of this webinar. We're going to have a panel discussion, mostly to talk about our experience. I'd like to hand over to Alexander Ng, Vice President of Tencent Healthcare. Thank you very much. I'd like to thank academician Zhong and academician Li for your wonderful sharing. You've made a great contribution and made great efforts in fighting coronavirus. Especially your discovery at the clinical practice is going to be very important reference for China as well as for the whole world going forward in controlling and mitigating COVID-19. I would like to ask you both, what are your biggest challenges so far in dealing with this epidemic? Perhaps I would like to give the floor to academician Li first. In my view, I think this epidemic is a new outbreak, is a new epidemic. How to really curb its spread, how to hold it. Academician Zhong made a very good point earlier, and I think that the critical point at this moment is to find its source and cut its transmission route and protect the susceptible population. That is key. And how to find the source? The key is to find out the source and actively treat the patients. President Xi said time and again that we must take in all the patients that are infected, and we must provide them all the treatment at our best capacity. Back then, it was a huge difficulty, huge challenge in the earlier days to treat all the patients. Then immediately 40,000 medical professionals rushed to Wuhan, to Hubei province, and set up mobile clinics and set up Leishan Hoshishan hospitals. So quickly resolve the issue. And once we take all these patients, as many patients as possible in hospitals, then we were able to take the epidemic control. And then we talk about masks, talk about reduce mass gathering, cut the transmission route, minimize maximize social distancing. And we said that we need to have antiviral treatment at early stage, and we earlier introduced quite a number of antiviral drugs. I believe these are important. And if we have antiviral treatment, we could shorten the course and try to minimize the migration to severe cases. And also when it comes to severe and critical cases treatment, we must cut the transmission route of cytokine storm to minimize mortality rate, minimize severe rate. When I was in there in early February in Wuhan, the severe case rate was high. But once we had ventilators, we had ALS, we started to have the blood ammonia balance, among others. With these measures in place, quickly we were able to reduce the mortality rate. So within a relatively short period of time, we were able to maintain its control. Thank you very much. It's not really easy.
Professor Zhong, so since the epidemic, what has been sort of the biggest challenge that you have faced, and how do you overcome that challenge?
I suppose with the light of the whole world, I think so. Based on the Chinese experience, I think right now, I think the lockdown, some high epidemic area, and then keep distancing and wear mask. That's the best way to prevent that from further spreading. I was worried. I'm worried about in some of the countries now, spreading very fast. So something like each day will increase about 10,000, something like that. So that's a big problem. So the more the patients, we will have a big problem, the burden, the lack of medical materials, lack of the beds, and lack of the medical staff. So of course, a big virtuous circle. And also, once in 200 countries, in particular in some big countries, I think once they cannot control the spreading, so it will be a disaster of the whole world. It's not only, so none of the country will be exempt. So this is what worry me most. I think now we have been trying very hard, and then up to now, I think from the data had been shown, so remdesivir, it works in some way. It's not really targeting therapy, but it really reduces the shortened course of the disease, and also hydroxychloroquine and chloroquine and hydroxychloroquine, it all works very well. So then can work, and then some of the patients in the United States of my friends, yeah, I recommend them to take hydroxychloroquine. It works. So after a few days, the virus loads turn into negative, and also. So this is what I'm very much concerned.
Okay. Thank you, Professor. May I just have a follow-up? Because I think one key message that you try to communicate is, while the two things that we can all do, right, is basically distancing and masks.
Yeah, that's right.
And now I think now after the presentation, there are actually more hope that as new therapies and new measures are coming along, right? I think we are trying to actually stay positive amidst this global fight against this epidemic. 好，再次感谢两位专家的精彩的分享。
Okay, thank you so much for your fantastic sharing.
And the Chinese achievements in combating COVID-19 cannot go without the support of different sectors and enterprises, as well as all of the society approach. For example, Tencent Health is using the big data to trace the dynamic of transmission and the development of the COVID-19 to help the country. And now Tencent Health has also launched the online platforms and instruments and offered that platforms and instruments to the overseas communities. And now I would like to give the floor to several experts from smart supply chains as well as economics, so that they can share their view and insights on the COVID-19 prevention and control in China. First of all, I would like to hand over to Mr. Gordon Liu from National School of Development of Peking University, who is going to talk about the macroeconomic policy of the country and its role in combating COVID-19. Yes, you have the floor, Gordon Liu.
Gordon, are you there?
Yes, can you hear me? Experts, ladies and gentlemen, good evening. I'll talk in Chinese. I'll speak Chinese because most cases, because our experience is mainly concentrated in China. I would like to highlight 3 points. First, the mankind is now facing the common challenge of COVID-19 as it spreads around the whole world. And up till now, as Mr. Zhong said, as of today, there are more than 930,000 confirmed cases around the whole world, and 47,242 deaths. And the case fatality rate is about 5%. And against this backdrop, we need to resort to the instruments and approaches mentioned by the experts in their presentations and speeches. Because this experience is of great value to us. At the same time, all of us, including me, myself, should not only listen to their instructions, but also refrain from causing additional trouble to these experts. Or causing irrational panic against the backdrop of the spread of the COVID-19. And on this note, I would like to ask you to think about, in the face of the pandemic, if we take a holistic and systemic approach, we can perhaps better assess the situation in a general manner. I'll give you some numbers and figures. According to the statistics of CDC, on a weekly basis, the China statistics is not really as sophisticated as the US, so I would like to resort to the US statistics from 2015 up to 2020, January 2020. The total mortality rate by all causes in the first week of January each year, the total mortal cases accounts for about 60,000 people. And then by the 10th week of each year, the curve starts to decline. However, 2020 was an exception because in the 10th week of 2020, the US started to impose interventions in turning the curve of mortality rate. And by the 10th week of 2020, the mortality rate in the US across all the states decreased to 47,000 people. And that happened thanks to social distancing, stay-at-home orders. Fewer and fewer people died from air pollution or car accidents or COPDs. And we know that air pollution is a major killer. for a lot of countries, including for China. In 2017, heart stroke, heart disease, stroke, heart diseases, liver cancers, car accidents, COPDs are major 5 factors and killers for Chinese people in 2017. And this also explained why the stay-at-home policy could play such an instrumental role in reducing the mortality rate across the whole world. And as we tackle pandemic as such, we should also think of the high mortality rate without the COVID-19. Because if we see this issue from that viewpoint, we could actually take better policies. We could avoid unnecessary panic, and we could also look at current challenge and current pandemic crisis from a more rational point of view, from a more systematic, holistic approach. And if we could resort to a more holistic approach, we could perhaps tackle this crisis better. And the second point I would like to highlight about the economic impact of the COVID-19. Generally, I'm not willing to do this assessment because we are yet at the end of the control and prevention work against the COVID-19. However, upon your request, I would like to give it a try. This should be a preliminary assessment. According to the assessment of Financial Times, they looked at 6 major economic indicators of China. The real estate sales, traffic situation in major cities, coal consumption in major cities, logistics, as well as pollution in major cities, box office in major cities. And these are 6 major indicators that can also depict the economic development and picture of China. And if we take January 2020 as 100, then this index dropped to its low towards the end of February, at the beginning of March. And the index fell below 60. And now, thanks to our efforts that led to the rebound of economy in China, now the index came back to above 60. And this is a sign for economic revitalization for them. And on a macro level, in GDP terms, what was the economic cost because of COVID-19? In the first quarter of 2019, the GDP was 21.3 trillion yuan. Had we not suffered from COVID-19, in the first quarter of 2020, we would see at least 22 trillion yuan of GDP output. And because
but if we could really have 60% recovery rate, then we could perhaps stop a loss of 13 trillion RMB. What does that mean? That means, put it in perspective, that's the combined volume of Beijing, Shanghai, Guangzhou, and Shenzhen combined GDP of last year. But if we were not able to restore 60% of our production capacity, for example, we were only able to restore 50% of the production, then we could at least 11.3 trillion RMB yuan worth of loss could be avoided. That means Beijing, Shanghai, Guangzhou plus Tianjin GDP combined. But we do not account for the long-term capital market loss, but we are only looking at the immediate loss. This is just an estimate. And now, point number 3, I just want to say that at this moment, this epidemic first outbreak first occurred in China, and then USA, in South Korea, Singapore, Japan. Where has it? What I want to draw attention to the whole world that this moment, South Asia, Africa, South America. Let's just take a look at the latest update on the world map. They're just having some small red dot, not in big red circle right now. It doesn't mean the next 1 or 2 months we're not going to have a similar outbreak as we are witnessing right here in China and the West. And if they did experience a major shock, is their healthcare capacity capable of handling such disaster? How many human lives have been lost? And that would mean immeasurable loss for the entire humanity. So we do have timetable right now. The window of time is still open at this moment. They haven't yet had a big major outbreak. It's just a small red dot. Well, with the presence of academicians, we are a community of the earth. If they had a major outbreak, it's impossible for them to restore reproduction of GDP within 1 or 2 months. If they had a major outbreak like we're experiencing here. And I heard quite a number of Nobel laureates have jointly signed a letter to be submitted to the World Bank, and WHO is also calling for that. So I would like to put forward that point as well. If these countries, they cannot solve these problems, imminent disaster, imminent issue, then nobody can handle this crisis for the world. Like you said, this economic impact for China, for world, and especially for less developed countries, for countries with stringent medical resources, the impact will be even more severe and devastating. In fact, two Chinese medical teams are leading to major clinical trials related to remdesivir. People translate that in transliteration way, call it into 人民的希望, people's hope. So we're very happy to have with us Rogers Luo, who is president of Gilead China and vice president of Gilead International, to tell us a bit about the story of remdesivir. And we know that quite a number of clinical trials are ongoing as we talk. I'd like to ask you to give us an update.
好，谢谢主持人谢谢这个几位嘉宾包括钟南山院士和李兰娟院士做了精彩的演讲那首先呢，我想允许我代表吉利德科学公司向这个此次投身于抗击新冠肺炎疫情中间的广大的这个医护人员致以崇高的敬意和衷心的感谢我想这个吉利德科学公司呢一直专注于这个抗病毒的这个药物研发。那么在过去30年中间我们研发了这个超过20款的这个治疗乙型肝炎、T型肝炎和艾滋病的药物。那么刚刚主持人提其实我们就已经这个判断可能这个药对新冠肺炎病毒有这个疗效，因为这个在我们研发的过程中这个 remdesivir 就是瑞德西韦对这个在体外和动物体内模型发现它对这个 SARS 病毒非典病毒和这个中东呼吸综合症的这个病毒就 MERS 病毒有良好的这个抗病毒的效果。那我们这次这个1月初的时候鉴定出来的这个新型冠状病毒 新型冠状肺炎的这个病毒呢，它在结构上与这个刚刚前述的两种病毒有非常类似的地方。所以从那个时候开始我们公司的全体员工就是这个夜以继日的这个进行工作主动的接触了WHO美国、中国以及欧洲很多国家的这个机构和研究人员，希望通过临床试验来确定这个瑞德西韦对新冠肺炎这个治疗的这个安全性和有效性。主持人刚刚谈到，就是大家对我们现在目前进展的这个正在做的这个临床试验非常关注。那这里我也一并呢做一个报告。目前全球有超过10个国家和地区参与了有关瑞德西韦这个治疗这个新型冠状病毒肺炎的6项国际研究那么这中间包括大家非常熟悉的在这个中国开展了2项这个随机双盲对照的这个研究来评估瑞德西韦在这个新冠肺炎中间的这个安全性和有效性。那么也包含了另外两个，一个是美国过敏及感染病研究所发起的这个随机双盲的这样一个对照研究，和这个WHO也发起了一个研究，目前正在法国进行。那么作为吉利德公司呢，我们自己也发起了这个2项这个评估这个瑞德西韦安全性有效性的2项研究。那么这2项研究目前已经有全球超过了70家的机构医院在参与其中入组的患者将会超过2000例以上。所以这个是我们目前这个药品就这个瑞德西韦在这个研发过程一些情况。谢谢。
If I could ask another question，
当然，因为这是目前呢，谢谢主持人。这个问题呢是这样的，我们现在目前呢，虽然还是在这个做临床试验，还没有这个获批嘛。那么在这个还没有获批之前呢，早在2月份，我们已经在全球这个组织我们的供应链，来这个希望能够提升扩大它的产能。因为这个疫情的发展的紧迫性，我们也没有等这个临床数据发表或者是这个批准，我们就已经做了巨大的投资，希望一旦这个产品获批呢，就能够第一时间尽快的送达全球各地，能够帮助我们的政府和医务工作者以及患者来这个改善这个病情提供这个支持。那么刚刚主持人谈到我们关于这个可及性问题，那我们呢希望能够在这个药品获批以后扩大产能后，能够确保这个产品的可支付性和可及性，因为这个是我们吉利德科学公司自从创立以来一直秉承的这个患者为先的这样的一个理念这是一脉相承的。我想这一次也不是例外，所以我想这个我们是会确保它的这个可支付性和可及性。谢谢主持人。
Thank you very much. I do hope that the people's hope remdesivir can be a hope for the treatment and COVID-19. And now everyone is now staying at home or practicing social distancing. So logistic companies play a crucial role in delivering services and goods to our households. And now I would like to give the floor to Dennis Xin, CEO from Jingdong Health, who is going to talk about their role in combating COVID-19 in terms of providing logistics, supply chain, and online consultation.
高丽博士中院史立院士，各位领导专家，还有我们依然奋战在防疫线的医护工作者们。 各位朋友
Ladies
们，
and
大家好，
gentlemen,
我是
health
金融健康的
professionals
陈
who
军。
are healthcare professionals who
今
are
天呢，
still
我
fighting
就
against the
刚才 Alex 提
COVID-19 on
到
the
的我
front
们京
line.
东和京东健康在疫情以来的一些工作呢，向各位朋
Alexander
友做一
talked
个汇
mentioned
报。
the
从疫
role
情
Jingdong
显
Health
现的
and
开始，
Jingdong.com
我们整个京东集
has been
团和京
playing
东健康在
overall
京东创始人刘
since
强
the
东先
outbreak
生的
of
统一指
COVID-19
挥
under the
和调度下，
leadership
我
and
们第一时
the
间呢，
guidance of
就是全面动员，有
Liu
重点有
Changdong,
步骤的
CEO of
展开了一系
Jingdong.com.
列的有效的举措。
Took a set of measures
进入疫情以
in
来呢，
a
基于
steady manner.
京东整体的智能供应链的优势呢，
Overall, we
我们
used
京东健
we
康
leveraged
充
the
分发挥了
advantage
药
of
品
smart
和医
supply
疗
chain
器
of
械等
Jingdong
物质的流通和供应能力。
and
作为全中国最大的
facilitated
零售平
the
台，我们从
delivery
货
and
源、
logistics as
仓
well
储
as the
配送、
supply
品牌
of
管控
pharmacies and
等方面
medications and medical
全力保
equipment.
障口罩等
And
防护
we
用品的
try to
供应
stabilize the
和
supply and the
价格稳
pricing
定。
of
这个
such
是非常
PPEs
重
and
要的。
other medical
合作厂商的货品呢，可以直接从
equipments like
工厂的生产线进入我们的仓库，并以最快的
through
速
our
度送
role
达到用
of
户手中。
as a
仅仅在
goods
1月份，
provider,
我们京东健康
warehouse
就
provider,
采
as
购
well
血
as
氧仪啊、
the
体温计啊、
service
呼
platform,
吸机等
and
各类
all
防疫
the
物资超过
partners
3000
of
万件，
our companies
用以满
can
足全国用户对疫情防护用品的购
deliver
买需求。
their products
我
from the
们也是
production
第一
line
家把
directly
医
to
疗
the
物资捐
warehouses
赠并
of
送达
Jingdong,
到
and so that
武
we
汉
can
协和医
deliver
院、同济医院等
these
这个
goods to
病
our
情
users in a
防疫医
timely
院。
measure. And alone in
特别是
January,
从1
we
月下旬
already
开始呢，全国各
acquired
地积
over
极响应
30
我们
million
政府和专家
oximeters
的
and
号召，
thermometers
开展了
to
居家防
cater
控。
to the needs of
多
our
地都实施了那
different
个交通管制，但是
users.
呢，
And since
民众的医疗
January,
健康需
due
求
to the
并不会
lockdowns
因为居家
and
隔离和
the
停止。
self-quarantine
特别是
policies,
有专家也提到，这个
although
新冠肺炎在
a
初期
lot
的
of
时候和
local
流感很
authorities
相似。
actually carried out
所以呢，
travel restrictions
在
and
这种
traffic
背景下，京
restrictions.
东健康
However,
充分利
the
用互联网
need and
平
the
台的优
demand
势，
of the
调动
public
了
in
服务供应
medical
链各
services
环节的
and
能力。
health services
我们积极地开展了
was
在线
not
问诊、
confined.
复诊
So
开
we
方
used a
和
lot of
送药
new
上门等服务。
technologies. For example,
从
the
1月
online
26号开
consultation
始，
platform
我们京东健康呢
of
上线了
Jingdong
防范阻击
Health
新冠病毒肺炎的
that
免
was
费
launched
在线的
on
问诊平
January
台。
26th.
并率
And
先
that
在互联
platform
网领域将
played
免费的
a
问诊
very
范
big
围扩
role.
大至全部的科
And
室
at the same
所有
time,
的疾
we
病
are the
领域。
first. We were the
同时
first
呢，
to
我们也邀请
extend
到这
the
个
free of
陆林院
charge
士、
consultation,
韩德利
medical
院士
consultation
等原来
through
在北
internet
京上市企业的
platform
董
to
事会，
all different
以及
diseases.
很多专
And
家
over
协同
30
我们3万多
healthcare
名
professionals
全职和兼职的医
for
生
this
在线服
platform,
务，
both
为
part
全
time
国
and
所
full
有用
time,
户提供免费
and
专业咨询。
providing
从疫
free
情开始呢
medical
到昨天嘛，
consultations
到4月
for
11号呢，我们京东健康在线问诊
Chinese
平台累
users
计的服务的
across
用
the
户
nation. And
接
as
近
of
800万人次，
yesterday, April the
每一
1st,
天的问诊
we
量
have served
超过
over
12万，
7
极大的
million
缓解了
users.
这个在减少外出
And this
活动
platform
期
was
间用户的
visited
问诊
over
和心理咨询的需
120
求。
times each day.
在助力疫情防控的同时呢，京东健康也我们同样关注到
was
慢
a
病
highlight
群体，
moment. And as we
因为慢病
combat
群体在这个时候他不方便
COVID-19,
这
we
个外
Jingdong
出
Health
在
also
居家
paid
隔离，
attention
我们
to
推出
the
了慢病关爱
patients
计划。
with chronic
慢病患者
diseases
呢可以通过
because
线上的问诊
they
平
were
台进
their
行复诊
movement
开方，
and
同时呢，我们
outgoing
联合
and the
了
goings and comings
70
were
国家
restricted
中外
by
药企，
the
也包括
quarantine
刚才
policy.
那个
So
罗
this
总
is
的这个
why
举例
we
的，
launched the chronic
我们
disease
共同保
care
障慢病群体的
programs.
药品供应，药品可以直接通过京
Not
东物
only
流
offered
送到
online
用户手中，
services
足
for
不出户呢
consultation
就
for
可
these
以
patients,
便捷
but
及时
also
的完
worked
成在
together
线的
with
复
over
诊
70
和购药。
Chinese and international
目前呢，咱
pharmaceutical
们中国
enterprises
国内
to
的疫情呢趋于
ensure
稳
the
定，但
supply
是全
of
球疫情在
patients
不断的扩
of
散，
medications
所
for
以呢，
these
我们
patients.
京东健康2周
And
前呢就
these
推出了
medications
全
and
球免
medical
费健康
equipments
咨询
could be
平台，
delivered
向
through
全球民众
Jingdong
提供
Logistics.
免费的在线咨询
And
服务。
as our
尤其特
experts
殊的
just
是呢，就是我
mentioned,
们
we also
包括
Mr. Liu
38位
Qingjun
在
also mentioned
湖北
that
一线
we
参加
also
过
launched
这个疫情
together
救治的医
with
生和30多位中医专
together
家，
with other
包括刚才
partners
钟院
and
士
the
提到的
global
这 这个像莲花清瘟这种重要的这种
healthcare
治疗
consultation platform on a
药
global
品，我们提供了这个很
because
多的解决方
the
案，
domestic
在这个平
situation
台上
of
为海
combating
外的这个民众
COVID-19 is
分享
coming
抗疫
is
经验和
becoming more
防
and
务
more
知识。
stable.
截止
And
到4月1号呢， 平
this
台已经收集到来自
platform
海外
as
累
of
计
the 1st
13
of
万多条
April
的问诊咨
has
询，其
received
中
over
英文咨询超过了这个
130 consultation
8000多条，
requests
访
from
问人次也
overseas,
超过了
among which
585万
over
人次。
8,000.
经过这2个月的这个全民抗疫，
And this
我们可以看到
platform was
互联
visited
网
by
医疗价
over
值真正的
5.85
得到越来越
million.
多的，无论是民众和政府
And
的
in
认
the
可。
process of these
我们希
2
望有
months,
条件的
as
国
we
家呢借
combated
鉴和参考
COVID-19,
中国经验，
we saw the increasing value and the increasing recognition of the value of internet medical services. And we do hope that countries that have the resources can learn from Chinese experience and Chinese approach to give full scope to the international internet platform for contactless service. And I do hope that we can win over this COVID-19 as soon as possible. Thank you.
In fact, given the interest of time, we have so many both domestic and international speakers that continue to share with us more important issues. But I would now like to, first of all, give the floor to Mr. Cao Kefang, who is a media opinion leader and also an ambassador for public health in China. I'd like to ask you, as an opinion leader, how to play an even bigger role in this current challenging environment in the capacity as a media person. Well, first of all, from the perspective of a media, I'd like to say that the biggest role a media can play is to truly give some timely and accurate information to be communicated to the general public. Right now, we have self-media, we have internet media, we have WeChat social media. We can see so many different varieties of information. The people are looking for accurate information on a timely basis. Earlier, Academician Zhong mentioned in his presentation that through mainstream media, every day we update to the world, to the people, to the general public, confirmed cases, number of suspected cases, so they know what's going on in Wuhan, in Hubei, and across the nation. And also CCTV and all the mainstream medias, SMG, they invite Academician Wang Chen, Academician Li Lanjuan, Academician Zhong Naishan to introduce to the general public and bring them up to date on what's going on in the front line, and also just to spread the knowledge and the information on people for how to truly control and mitigate the outbreak. Yeah. And also charitable organizations like China Primary Healthcare Foundation and all these important like NGO organizations that are capable of pulling together all the healthcare opinion leaders, the VIPs, to be here to tell everybody. For example, Academician Zhong just said, how could it be possible that China was able to take the outbreak under control in such a short period of time? One, China opted for an approach which is suppression, given its, despite of its huge impact on the economy. Second, on social distancing and wear mask. This is a key reason for minimize the spread of the disease. And third, they would introduce to the general public on how the moderate cases, the minor cases, mild cases, and common cases could curb its migration into severe cases. And all these important messages are going to be communicated to the general public in a timely way, and everybody needs to pitch in, media in particular, to play a guidance role as well. Thank you. That's all. Now, I would like to hand over to Jiang Fang, who is the initiator, the leader, and the facilitator of this roundtable, this webinar. She will continue to lead the discussion.
So join us today. We have from the U.S. Dr. Nivi Rao, Senior Vice President and Senior Advisor to the President at the Rockefeller Foundation. We also have Dr. Horace Welt. He is a respiratory clinician and advisor to the German government on COVID-19. We also have Professor Songming Kwang, who is a professor at the School of Public Health of the University of Seoul, Korea. And also he's a chairman of Korean Health Economics Association. We previously had Dr. Nore Okbama, Ogmare, from Japan, but he has to run for another meeting. So for the next session, I'd like to hear all of you, your perspectives in terms of what is going on, what are the challenges you're facing, and what is working, and how the world can best collaborate. Now, I'd like to actually extend my question to Dr. Rao. So how is it there in New York?
Well, we have different situations in the different countries in Europe. We have a big problem in Southern Europe and less problems in Northern Europe. I think the main reason for the big problems in the South had been that, a little bit similar to Wuhan, the pandemic in Southern Europe, mainly in Italy and Spain, started very dramatically with a very quick increase of patients, and for this the healthcare system was in a way overrun. So we had big problems to have enough intensive care capacity for the patients in these countries. The Northern European countries had the advantage that they could prepare for a longer time because the pandemic started 3 to 4 weeks later than in Southern Europe. And some of the Northern European countries, Scandinavia, Germany, Austria, Switzerland, the healthcare resources are by far higher than in the Southern European countries. So in the North, we were better prepared. We start lockdown, and we use the example of China and what had taken place in China much more earlier, and for this we had much lower mortality burden than in the south of Europe. Altogether, at the moment, we have lockdown in most of the European countries with preventive measures as described from the Chinese colleagues, and with very few contacts between people. So school and kindergarten both are closed, and we have a lot of people in quarantine at home. With this, we have a drop down in the increase of patient numbers. We are still not at a plateau, but the doubling of patient numbers have dropped down from a doubling every 3 days now to a doubling every 10 days. And I hope this will proceed. If this is the case, and this is the message for Germany, in Germany on the 20th of April, which is in 3 weeks, we will have a discussion of a partial stop of the lockdown. But we have to see how it works in between the next days. In terms of treatment, we are not so optimistic as the Chinese colleagues. So I do not see such an advantage by using chloroquinolone. Maybe it's better with remdesivir, but we, the Europeans, now we have a WHO study program, Solidarity, which is rolled out in all European countries, starting randomized controlled trials for all the drugs which had been discussed during the evening. That's the report from Europe.
Thank you very much. I'd like to go around the table and actually have Dr. Nivi Rao to tell us a little bit about the situation in New York.
Yes, thank you for the opportunity. In USA, we seem to be cresting and we seem to be on the rise. We have 216,000 cases with 5,000 deaths. But New York City is what I'd like to talk about. We have 83,712 cases and 1,941 deaths. But to me, the statistics that is really occupying my mind is that the daily new cases, around 6 to 9,000, there's a 32% increase day to day, and the death rate, the daily death rate, which is around 250 to 300 per day, is increasing at about 31%. So we are on that stark, sharp rise. We are also doing the same thing of lockdown, social distancing, but the feeling is these are very blunt instruments. We're locking down everybody, whereas some of them are either infected and immune, and some are not in that high risk. So there is a whole movement right now to see how can we get a two-pronged testing approach. Can we do an acute testing for acute illness, but also can we start thinking about doing an antibody testing to see who is infected, who is immune, in certain ways, who can go back to work and resume if they have the antibodies. Also downstream, when the vaccine is available, this will help us kind of prioritize who gets the vaccine, who doesn't. We know that the pandemic like this kills three ways. The first is the virus itself, but the second way people die is because of health systems breakdown. So maternal deaths, child deaths, deaths from other causes will continue to increase. And in fact, we know historically, for example, during the Ebola outbreak in 2014, 2015, the incremental deaths, just the incremental deaths from malaria, was much more than the total deaths from Ebola. So the second way it kills is by health systems breakdown and inaccessibility. And the third way it kills is because of financial destitution, and the mental and the financial destitution and poverty, and that it affects the poor and the underprivileged much more. So it kills three ways. We are all focused on the vaccine now, but very soon we will have to focus on what do we do to make sure that people don't die from other causes that are exacerbated because of what's happening in the health facilities right now with the quarantine. And the third way is we need to make sure people, the vulnerable and the destitute from financial causes, that we support. So we need to work on these three ways, and the whole debate is around whether this is going to go the Ebola way, where in Ebola just social distancing, contact tracing, identification, quarantine was enough, or is it going to go the flu way, where it is seasonal and will come back and it'll do havoc till we get about 60 to 70% herd immunity. So we have to see which way it goes. In the meantime, we are struggling. We are being overwhelmed. In New York, we realize that the worst is yet to come, and the month of April is going to be particularly dangerous for us. But we're trying to cope, and we appreciate all the concern.
Thank you very much for sharing. I'd like to move to Professor Kwong. It seems like Korea is doing a really great job. The virus is seen to be contained. The curve is being flattened. What's your opinion in terms of, what really worked? What could be shared with the other part of the world?
Okay, you're right. Korea, it seems, still we have some uncertainty, but it seems that we are managing to slow down the rapid growth in infections. I think I can comment about three key factors we considered, we introduced. First one is, I think, it's a very early move. So for this, I would say we should not worry about overshooting. We can overshoot, because overshooting is better than undershooting in a way. So Korea, around the end of January, at that time, we had less than 10 confirmed cases, but government already started to prepare the test kits. So there's a meeting between government and test kit producers. Need to produce prepare. And then the government provided early approval, rapid quick approval, and they started to produce a lot of test kits. And then government introduced a kind of mass scale testing. And at that time, we are also not very convinced whether this is the right approach or not. It's a very mass one. And then, because of this mass testing, we found very rapid increase in cases. Of course, there's some mass infection in a big cult churches. So we have a huge number of patients. So initially, all those patient cases were hospitalized, and then we soon realized that we don't have enough beds. So government started to prioritize such that if you are a severe patient, then you go to the hospital. If you are a milder patient, then government converted some kind of a residential hotel kind of things into residential treatment facilities. So mild patients are staying there, like hotel, and they are attended by the doctors. So I think this type of a very mass scale testing contributed to the finding cases, isolating the cases, and treat those most serious one. And then after, also at the beginning, there are some cases that in the process of testing, the case infected the facility, whole facility. So the facility should be shut down in the case of infection. So to avoid that type of potential infection, there are some innovations like drive-through. So we have the drive-through, McDonald's drive-through type thing. We have the drive-through testing states, and we now even have a kind of open-air outdoor testing facilities. It seems to be working, that one. Second factor is tracing of contacts. Because so far, Korea did not lock down anything. So all the restaurants, all the shops are open. Airport is still open, although there's now starting yesterday, we introduced a mandatory 2 weeks of quarantine. But that's just introduced yesterday. Before that, still everything open. But instead of no lockdown, we introduced a very aggressive tracing of contacts. This again is very controversial because there are some privacy issues. Because for the patient, there's interviewing the patient, and then we check the credit card use, check the mobile phone locations, check the CCTV in the neighborhood. So in the Western societies, probably it cannot be accepted because of the privacy issues. But in the case of Korea, we had some painful experience of MERS. Like 5 years ago, many people died in the MERS. So after that, I think there's a broader social consensus that we should use this type of very aggressive tracing of context. So I think we have a choice. One option, lockdown, and we don't have to worry about privacy, just a lockdown. Another option, no lockdown, but instead of the no lockdown, there's extensive tracing of contacts. And then government send the text message to everybody in your district. If this is a case, this confirmed case traveled, this public transportation visited this restaurant, shops. So anybody who were exposed to this contact, please come to the station of testing. So this type of extensive, aggressive tracing of contacts avoid us from the lockdown of things. But it's a choice, I think, social choice, because in a democratic society, we need a social consensus. But as I'm an economist, so if there's a lockdown, there's a huge economic cost. So if we avoid lockdowns, I think the social economic cost is a little bit lower. Number three, I think some social capital issues, because I think similar in Japan, Korea, China, there's a mass social campaign. Okay, everyday government campaign, broadcast, wear mask, wash hands, social distancing, and it seems that people follow that advice. Okay, in Korea, in China, I think same. But if you don't have a mask in the public space, people will tell you, people will push you to wear a mask. So this level of social capital, social pressure helps, I think, helps people to comply with this type of government policies and social distancing, things like that. That's it.
Thank you very much, Dr. Kwong. So definitely the current experiences have been proven successful in Korea, but in different cultures. I'd like to know actually whether it would work in the culture such as Germany and the US, and possibly I'd like to have Professor Zhong to comment as well. So maybe we'll start from Dr. Weld. How do you think? Yeah.
Yeah, well, I think in Germany and in most of the countries in Europe, a tracking system would be very difficult to implement, because in a way it's against what is normal in our countries, and there is a lot of concern that this is a restriction of freedom, which we are not known to do. However, it's a question how long and how severe the pandemic is. And the lockdown, as it is now in the European countries, could not stay for longer than, let me say, 6 to 8 weeks. So we have to come back to normal in between the next 2 months. And after Easter, the discussion will come up. What are the best methods to come back to normal, and maybe tracking systems are back on the table, are back in discussion again. It's a question of how the numbers will proceed in between the next 2 weeks.
That's clear. Thank you.
And it's quite similar. It's quite similar here in the U.S. The population, by and large, will not accept this kind of aggressive identification and testing. Issues of data security, privacy are very, very strong, and there's this is being pushed back. However, we are absolutely cognizant of countries like Korea, Singapore, where testing and active identification, quarantine, and contact tracing, as was described, has made such a big difference. And so while we see it and we understand it cerebrally at a gut level, it's a long way before Americans are going to be agreed to have their credit cards, their movements, all monitored. And so while we see the value of it, I'm not sure America is prepared for this kind of testing and contact tracing.
Thank you. I'd like to have Professor Zhong Nanshan to also respond to Dr. Kwong's point, and possibly to the other two doctors' points of views.
I really appreciate the points. I mean, Dr. Kwong had mentioned about it, because they have a very serious lesson happening in MERS. So I know what's happening at that time. So more than 30 medical staff being infected. So they are very aware about what will be happening in this pandemic. In particular, I mean, in the COVID-19 infection is much serious than MERS. So I think you have done a good job. So mass tracing. So because of course, that's different from country to country. I think in China, we are unable to do a mass testing. So we need to do that. So another point, I think, because you have found some of the patients, although they are virus carrier, but they are infectious. So they are contagious. So if you have a good quarantine, that's good for stopping the further spreading from this kind of patient. So another point I really appreciate what has been done. Dr. Rowe had mentioned about. I have noticed in recent days that the patients getting much higher. One of the things you have done a lot of mass detection test. I know that the technique is quite advanced. So in your country, about 15 minutes can handle one patient. So in other country, however, something like 1.5 hours. So you've got the machine and can handle extracting the RNA and then test immediately, taking about 15 to 20 minutes. That's good for us, I think. And then you can find so many cases. In fact, with COVID-19, a big point, I suppose, will be how to isolate them. So in particular, some of the patients. So once, if you just give more attention to those who have symptoms, or what happens, they have no symptoms. So they are actually very infective. So that's a big problem for human-to-human transmission. So I suppose we need to have some further action to isolate those who show a positive RNA test. So in order to block the further spreading, that's very important. As I had mentioned, so it's gradually spreading to southern part of states in the U.S. So I think you really need to take some action. So to do that. So otherwise, I think United States, on the one hand side, you have very advanced technique to find out what how many numbers of the patient. But on the other hand, to do something for that. So distancing and isolation and all the things. So that's what I'm thinking about. So I think in northern part of Europe, it now is I think in Germany and then even in Italy, I think it approach to the peak. So something like as far as you had mentioned, and as well as Dr. Rowe, I think you had your own culture. So it's impossible to set up this to follow this policy like in China. But anyway, I think distancing and wear mask, it will be reasonable to prevent further spreading. So it's we cannot rely on the special. I mean, even remdesivir, it works in some way. We have done some tests, and that's one point. A very important point. The first priority is prevention. So that's very important. I'm a little bit worried about what will be happening in the U.S. It's a global problem. So 10,000 each day. Wow. So I think that's really need to take some further stronger action by the central government. That's what I think about.
Thank you, Professor Zhang. We hear different. We hear different opinions. We hear different measures that been working in different cultures. But I think the question now is really for us to think about how we can collaborate, and that's also what our audience really care about. So, given the time, I'd like each of you to actually name three things on your mind that you think that the world can work together, different countries can collaborate to achieve. Please go ahead.
Let me start because I have to leave the meeting afterwards. So I think the key question is communication. It's fantastic that we have this meeting today. We have to share experiences. We have to share our data. We all now build up biobanks. So we have to collaborate in research, either in basic research and in clinical research. And if something like coronavirus brings the world more together in combining the activities in research and daily practice, this had been a good thing out of the bad catastrophe.
Thank you very much. Communications, we hear your message. Dr. Rao.
For me, the three things are visibility in supply chains and personal protection equipment. How do we make sure there's a global view so that we can move equipment from countries that have it to countries that don't have it, and we need to all work as one rather than individual countries. And so the first thing is to have a global supply chain with line of sight on PPEs. Second is we need a global data scorecard that will tell us exactly the things, but not just crude numbers like number of cases, number of deaths, but epidemiology behind that, age groups that are being affected, and on that allow us to get a little more on the epidemiology behind the numbers. And the third is, for me, we all need to focus on Africa collectively, because right now that is not an issue. But if Africa becomes the hotbed, then that would be there for the whole world as a source that we'll have to worry about. So I think the third point is we all need to come together about Africa.
Thank you very much. So global supply chain.
I say bye-bye, so I have to leave. So thanks and have a nice evening.
Thank you, Dr. Wang.
I have to leave.
Healthy.
I have to leave soon.
Okay,
so
please go ahead.
I agree with my two colleagues. Communication, but collaboration in the research and development because there's some kind of global public good aspect. So I hope that the countries are collaborating in the research and development for the treatment and medicines. But also, I'm an economist and I'm a policy person. Also, there's a lot to collaborate, to exchange ideas about what kind of policies are working, how, in what context. So there should be a lot of policy learning. Thank you. Thanks a lot. Bye.
Thank you very much. Bye. Okay, now we'll move to Professor Zhou.
Well, I think it's times are running out.
Yes.
So I totally agree with you, both Dr. Wells and Dr. Rose, and your point. So collaboration is very important in terms of communication. So actually, we have a lot of communication with Europe and with the United States, our colleagues, and in terms of the about the how to make a fasting testing, so diagnosis and differential diagnosis, and also, as you know, the influenza, how to different that from influenza, so the accurate diagnosis. And then we have some actually have some trial, so we'll be coming out very soon and tell the world, our colleagues, what kind of medication is actually working. So at least partly working, that to reduce the mortality. So we are working, both of us are working very hard to try to push the work forward. As in particular, of course, vaccine. So we are on the way to doing some phase 1 clinical trial, and then trying. So no matter which country is the first to develop this kind of vaccine, we all welcome that. It makes some benefit to the human being. So okay, collaboration from each other. Thank you.
Thank you very much. So now, because of time, I'm going to hand over back to Mr. Cao. 曹老师，那我就把时间交回给您了，谢谢。
Over to you, Mr. Cao.
谢谢。中外的医学的这个防治呢，做了很有见地的这个发言。那么现在呢，我们还有最后一点时间，我们有请中国初级卫生保健基金会曹希勇理事长为我们今天这个活动呢做一个总结的发言。来，曹理事长。
好，你好。尊敬的陈卓主席、高丽博士、钟南山院士、李兰娟院士、国内外的嘉宾以及所有观看今天直播的医护工作者们，大家晚上好。刚才新冠疫情防控国际经验分享会非常精彩，感谢各位嘉宾都在以同呼吸共命运的大爱 参与经验的分享和交流。无论是疫情防控的各国经验，还是最新的诊疗研究，疫情期间的联防联控以及国际合作，对于在全球范围内遏制疫情的蔓延都是至关重要的。相信这些重要的信息和经验，对于中国接下来巩固防疫成果和帮助世界许多国家战胜疫情都具有极为重要的指导意义。作为健康中国国际公共卫生管理培训项目的承办方，中国初级卫生保健基金会自1996年成立以来，始终致力于中国医疗卫生保健事业的发展，并且充分地发挥公募基金会社会公益平台的组织优势，广泛地与汇结社会慈善资源力量，投身到初级卫生保健事业。在此次抗击新冠疫情期间，中国初级卫生保健基金会积极的募集和协调资源，为受益的地区提供了重要的紧急的资源支持。截至3月27号，初保基金会捐出了现金2292万余元人民币，捐出了口罩、防护服，包括 CT 等大型医疗设备在内的各种各类的医疗物资7467万人民币。除此以外，作为由中国农工民主党中央主办、国家卫健委主管的基金会，将继续发挥领域的优势，在全球防疫形势依然严峻的情况下，积极响应世界卫生组织倡导的各国加强经验分享，推出为一线临床人员量身定制的健康中国国际公共卫生管理培训的项目，通过及时的总结抗击新冠疫情的经验。
Because we continue to have such a big international outbreak, and we hope that we will continue to help medical professionals and healthcare people to continue to improve their skills and their capability, and to promote the development of public health management system. Our training course will be in bilingual, and it will be composed of 4 modules. 1, public health summary, and nosocomial prevention control, infection control, a new tech application, and outbreak mitigation, and the patient's doctor relationship, as well as China's healthcare professionals accountability, and the new media communication against an international context. Each week we will have 2 courses, altogether 16 sessions and 4 seminars. It will be open to global healthcare workers free of charge. Today is the official launch date of this program. The first course will be given on 7th of April. Everybody feel free to scan the QR code on the screen or register by opening up the link. Start your learning. Once again, thank all of you. Let's work together, put together our resources, and everybody will enjoy health. Once again, thank you very much. Thank you, President Cao. Earlier he said that I hope that everybody who are doctors who are participating in Healthy China International Public Health training program, please scan your QR code and make your registration application. And the first course will be kicked off on 7th of April. So this brings us to the end of today's seminar. As all the experts have said earlier, as long as we continue to work together, we will definitely bring into reins the outbreak of the epidemic, and we will come back to our peaceful and happy life. Enough. Thank you all.
谢谢理事长。
Thank you. Thank you, Mr. President. Thank you, Academician Zhong. Thank you, Academician Li. Thank you all. Thank you.
Thank you, everyone.
We'll have more opportunity to catch online. Thank you so much for your hard work. Thanks a lot.
That's fair. I think we should just go to